Neonatal surgery, the art of operating on life measured in grams and heartbeats per second. In this video, we'll explore the complete roadmap to optimizing outcomes for neonates before, during, and after surgery. From risk stratification to family-centered care, every detail can mean the difference between survival and setback. The journey begins long before the first incision. Preoperative care in neonatal surgery is a delicate orchestration of physiology, precision, and teamwork. Every neonate is evaluated through a multidisciplinary lens. Neonatologists, anesthesiologists, surgeons, cardiologists, and geneticists collaborate to identify risks. From congenital heart defects to metabolic disorders, early identification guides every downstream decision. Thermoregulation, hydration, and infection control, three pillars that must be perfected before anesthesia even begins. A single-degree drop in body temperature can trigger acidosis and hemodynamic collapse. Every IV fluid, every antibiotic, every calorie counts. High-quality imaging is the surgical map. Ultrasound defines anatomy, MRI refines understanding, and selective genetic testing uncovers hidden syndromes. In neonates, the smallest shadow can redefine the entire surgical plan. Neonatal anesthesia is an art within an art. Drug metabolism, organ maturity, airway anatomy, all differ from even a 1-month-old infant. Anesthetic protocols must balance gentle induction, controlled ventilation, and vigilant monitoring. Short-acting agents, low tidal volumes, and strict thermal regulation are the golden rules. Post-operative analgesia is just as critical. Neonates feel pain deeply. Multimodal strategies combining paracetamol, regional blocks, and minimal opioids ensure comfort without compromising safety. Inside the operating room, every movement is deliberate. Every suture is a promise of survival. Neonatal tissues are fragile. Hemostasis must be perfect, and handling must be feather-light. Many surgeries now use minimally invasive approaches. Laparoscopy and thoracoscopy in neonates are no longer experimental. They're transformative, offering less pain and faster recovery when done in expert hands. Consider this. A 3-kilogram neonate has a total blood volume of about 240 milliliters. Losing even 10 milliliters is significant. That's why every drop matters. Preoperative correction of anemia, meticulous hemostasis, and restrictive transfusion thresholds are vital. Modern perioperative protocols use point-of-care testing to guide transfusion decisions in real time. The surgery doesn't end with the last stitch, it continues in the NICU. Postoperative care defines the final outcome. Ventilatory weaning must be gentle. Pain control must be humane and evidence-based. Aseptic technique continues. Every central line, every dressing change counts. Nutrition becomes therapy. Early enteral feeds, ideally breast milk, are the first prescription after surgery. If not possible, parenteral nutrition keeps the neonate growing and healing. Families are integral to care. Parental presence during rounds, honest communication, and emotional support transform outcomes, both medical and psychological. Great surgery depends on great systems. Enhanced recovery after surgery, ERAs protocols, regular audits, and data-driven benchmarking are now standard in high-performing centers. Simulation training keeps surgical and nursing teams ready for crisis moments. Every case, whether successful or not, becomes a learning opportunity. In neonatal surgery, perfection is not a luxury, it's a duty. From preoperative stabilization to postoperative family care, each step is a chance to improve survival and quality of life. The modern pediatric surgeon is more than a technician. They are a leader, innovator, and guardian of the smallest patients. Visit www.pedsurg.org for quizzes, updates, and educational resources.